Thanks very much for coming this morning. My name is John Peter. I'm the Chief Medical Officer here at Cardinal Children's Hospital. I'm one of the ER attendings. You all likely have seen some recent news stories about drownings and drowning events, all very tragic events, and really not all that uncommon in the summer, unfortunately. Temperatures are hot. You know, we've witnessed a lot of that recently. Everybody's just trying to cool off, going to swimming pools, lakes, rivers, that sort of thing. Along with these stories of these events come terms that sometimes are very poorly described, and they're very frightening, leaves people wondering just exactly what they should know, what they should understand about these events. Earlier this summer in Texas, there was a young child who died following days of vomiting after being in shallow water about a week earlier. That event went viral, and it was labeled as an alleged cause of dry or secondary drowning, which really sort of put the fear into a lot of parents whose children had been, in the water, had a coughing event afterwards, and just left them wondering what sort of medical attention they should seek. We need to be particularly vigilant in healthcare about sharing correct and meaningful medical information with our families. And we need to help them understand just exactly what these terms mean, and are they even real terms? If your child experiences a problem in the water, what do you need to do? When should you seek medical attention? Today, we're going to share that information with you about how to practice the best water and safety possible, not only from members of our team here at the hospital, along with Elise and her mother Jamie, who've been kind enough to join us here at the hospital today. Dr. Jeremy Garrett, one of our critical care physicians, Dr. Stephen Laffey from our emergency department, as well as the director of operations, and Lori Winkler, our injury prevention nurse, will all be part of this discussion. We'll have a few questions and topics for our panel to sort of address, and then we'll open it up to questions from the audience. Dr. Garrett, we'll start the discussion with you. Let's start with some of the terminology. We often hear terms dry, secondary, or near drowning. And can you shed some light on those things?
Well, when it comes to drowning, thanks. When it comes to drowning, there are really only three terms that truly apply medically. But there's a lot of confusion about many other terms that have been used for years. And we as a medical profession have used some of the jargon, perhaps incorrectly. The three events that you can have with a drowning are to be lethal. You can have drowning with illness or injury, and you can have drowning with no subsequent illness or injury. Those are just really the three outcomes. The other terms of secondary drowning sort of make some sense, but never really got a true medical definition. Dry drowning has its roots probably in a lot of things, but mainly the fact that when most drownings occur, very little water gets in the lungs itself. The drowning itself is more of a suffocation process than anything else. And wet drowning versus dry drowning, all these terms, just sort of descriptive, but they don't really produce anything other than confusion and fear. Now, drowning remains a tremendous public health issue for children. Every year, including this year, we'll see deaths from drowning, not just across the nation, but here at Cardinal Glennon. Every day, on average, through the entire year, there are essentially 2 pediatric deaths of 14 or under, plus another 2 teenage sort of age deaths. 10 total people average out a year dying a day, 10 a day, for every 365. Our peak incidence is right now in the summer. It's weekends and holidays, so actually it's a little better than we're a weekday. And it's when it's really hot, which is right now. We see, unfortunately, too many drownings. And males, regardless of the age, whether infant, toddler, child, adolescent, old, or even very elderly, males have a corner on it at about 3 to 4 to 1 over females. And why that is, another question. But these terms, they produce a lot of fear. And what should you worry about? That's what we need to talk more about today.
Thank you, Dr. So, Dr. Laffey, can you give us some pointers on the emergency department experience with drowning?
So the question then comes up, when do we have to worry? When do you need to seek care? When do you need to come to the emergency department? One kind of simple way to think about it, any symptoms that go beyond, one way to look at it would be any symptoms that go beyond what you might expect to see from a glass of water or a drink kind of going down the wrong pipe. Okay, so you can kind of, drinking, suddenly there's coughing, there's choking, there's gagging, oh boy, you pat on the back, get better, everything's fine, thank goodness. Those kind of symptoms are okay, that's kind of what we're comfortable with. Coughing, a really bad cough for a couple of minutes, get better, everything's fine, you okay, yeah, I'm fine, good. Those kind of things we're comfortable with. Anything that goes beyond that is someone that's probably going to benefit from being seen and evaluated by a physician. So really prolonged coughing that doesn't get better, any kind of difficulty breathing, certainly if they're not acting right, if they're not behaving properly, if they're lethargic, sleepy, confused, or any of those types of things, any of those situations, we're definitely going to want to evaluate that patient in the emergency department. We know that even when patients have these fairly minimal symptoms, like just a bad cough or prolonged, kind of some difficulty breathing, we know that there are a very few of those that will go on to develop more severe symptoms. And I think that's where a lot of that confusion with secondary or delayed drowning is. And that's where that kind of confusion comes from. Because we know that patients who have fairly minimal, I'm not talking about the super mild ones like the water going down the wrong pipe, but prolonged cough or not acting right or that, we know that a small number of those kids are going to go on and develop more severe symptoms. And that's where those words like delayed drowning or secondary drowning. But it really isn't delayed or secondary. It's a process that began with usually fluid getting in the lungs, disrupting some of the lung function, and that can progress over time. Certainly they can have complications like pneumonia and those type of things. So from our perspective, I think what we're trying to clarify is that this is a process and not these kind of separate events. So you have these, you're a little bit more concerned, maybe not breathing right or prolonged cough, you bring them to the emergency room. What do we do? Well, primarily we observe. We kind of watch and see what happens. Over the next several hours, kid will get better, symptoms all resolve, maybe do a chest x-ray, it all looks good, everything's fine. 3 or 4 hours later, we'll be comfortable sending that child home. We know that after a period of observation of 4 to 6 hours, if the patient's really doing well at that point, that their symptoms were mild, we know that there really hasn't been any cases ever described of that child going on and having problems or deteriorating or getting super sick. So generally that period of observation is going to be adequate if they get better. And if they don't, if the symptoms persist or we see changes on the x-ray, then we're going to continue to observe. And again, hopefully keep our fingers crossed. Hopefully over time things will get better. But again, as Dr. Garrett well knows, up in the intensive care unit, sometimes these kids do progress into more serious disease and more serious illness. Usually in these cases, or when you read about it in the media, they'll talk about this very rare instance of secondary drowning or very rare instance of dry drowning, and actually that's not really the case. In fact, most cases of drowning are non-fatal drowning, right? Most kids don't die when they drown. They are non-fatal cases, and it's not really that uncommon that these symptoms do kind of progress over time. And that's actually much more common than actual fatal drownings. About 5 to 1, you'll have non-fatal to fatal drowning cases. So I think it is helpful to keep those terms kind of clear. So we're kind of all speaking the same language. A lot of medical professionals in the audience here. I think it's our responsibility to kind of make sure that we put out a clear message, so we're all again kind of talking the same language as to what's going on with these patients. We're not downplaying this by any stretch. We really do want folks to come to you. If you have any concerns at all, you come on to the emergency room, let us take a look. And again, after that period of observation, many times we're able to send kids home safely. If not, then we keep them in the hospital and we go from there.
Thanks. We're going to ask Lori Winkler to join in our conversation here. Lori is the head of our injury prevention team here at Cardinal Glennon. She's been very busy this year. She spent a lot of her time doing outreach visits to numerous events and schools and organizations to talk about this very topic. In addition, Lori will do the honors here of introducing Miss Jamie Nipper and her daughter Elise. Elise was one of our patients here at the hospital, and she'll have some special messages for us as well. Lori?
So prevention is the key for anything. Unintentional injuries are the leading cause of death in children from birth to age 19, including drowning. So if we can prevent situations such as this is happening, then that's what our goal is and that's what our job is. So there are some things when we educate and when I am out in the community with our parents and caregivers and friends that may not have children, is that you want to make sure that that swimming pool that you own, that there is at least a 4 to 5 foot high fence on all 4 sides, that there is a very secure lock gate, that it stays locked when no one is in that swimming pool at all times. But most importantly, every child needs to be under direct, uninterrupted supervision. For our younger children, we recommend that they state numbers, 3 feet. However, we're not going to have a yardstick with us, so it's within an arm's reach. And we kind of do that helicopter. That child needs to be within your reach. Your eyes never leave that child. You always are watching that child. The other thing is, what happens if it's a group of us that we're all going out and there's 10 or 15 children there? Is it our responsibility to keep an eye on every single child at every single moment? The one thing that we advocate is the use of a designated person to be that water watcher or that pool watcher. And in addition to us watching our own children, they kind of oversee and watch all of the children in that group for a determined amount of time, 10 minutes, 15 minutes. Their cell phone needs to be on their person, but not in their hand, and they do not need to be on that phone at all, period. They need that phone with them in the event that they need to call 911. One of the misconceptions are that lifeguards are present, and it's their responsibility to watch the children. That is totally a misconception. That lifeguard has 41 or 42 other things that they need to be doing other than watching your child. Therefore, it is like imminent that we watch our child at all times. The other thing is to get your child enrolled in swimming lessons. Encourage our parents to get their child enrolled in swimming lessons, and what we need to advocate is everyone needs to know how to do CPR. Make sure that if they are in water, that they are only wearing a personal flotation device that has been approved by the United States Coast Guard. So what I tell my parents is that if you go out shopping, just because it has Dora or the Ninja Turtles, if you do not see the United States Coast Guard symbol on it or this tag on it, do not purchase that device because it is not authorized or has been approved to be safe. Water wings, they're cheap, they're easy, they're not a personal flotation device. I would like to now have the honor of introducing Jamie Nipper and Miss Elise. And Jamie's going to share Elise's story, how she came to Cardinal Glennon, and other things that you can help us to relay to our parents, from a parent's perspective.
Thank you. Gosh, I'm a little bit overwhelmed with emotion looking around the room and all of you guys. You awesome work here, and I just want to tell you how much I appreciate you all. We got such good care whenever we were at Cardinal Glennon. I mean, I know that you all really, really care from the bottom of your hearts about your patients. So thank you all for putting this seminar on. This is really, really important for our community. When they say that it can happen to anyone, I know that all of this information seems very, very basic and general and just like, of course we would do these things, but I promise you, I knew all these things. I was a lifeguard in high school. I was a lifeguard in college. I gave private swimming lessons to children. I knew the importance of safety in the water, and we were vigilant with safety. You know, our family loves water activities. My older children are on the swim team. We go to the lakes, the creeks, you know, we go to people's pools. We swim all the time, and we always watch our children. But it can honestly happen in the blink of an eye, and that's what happened to us. Thank goodness we had an amazing recovery, and we're here today to be, you know, thankful and joyful. But I'm glad, I'm honored to be here today just to share this story and this message with just the importance of water safety awareness. So before the accident, very active in the water. After the accident, once we got through the recovery, we came home and we wanted to get the message out to everybody how important CPR certification is. Basically, Elise's results was very contingent on the fact that she received CPR the moment she was found while we were waiting for the EMT to arrive. So effective CPR is critical. Once we got home, we just wanted to make sure that we got her into swimming lessons, and we got her on the swim team, and actually she has really progressed, and she's now swimming and able to hold her breath and go underwater and do her crawl stroke and all that great stuff. But she's got some videos that she's really excited to show Dr. Garrett so that she can show everybody what a great swimmer she is now. But if I could just do anything, I would tell you how important it is, just direct supervision of your children, CPR certification, making sure that you're not relying on that lifeguard in the pool, that you are, watching your child like a hawk around the water, and, just being ready. Thank you so much for having us.
Thank you very much, Ms. Hemper, for those really important words and kind words to everyone who took care of your beautiful daughter that's fortunate enough to be able to join us here today.
Can I ask, Jamie, how old was Elise when this happened, and what were the circumstances?
She was 3.
3?
And we were at a private pool party. There were about...
Sorry, she was 3. So 2 years ago, and we were just at a private pool party, and same as what they described, it was just a really hot day, wanting to cool off with some friends. There was about 12 moms there and about 15 other children, and we had been in the water, and she had one of these on her for about 3 hours, and I was right there with her. Well, it started storming, lightning came in, so we got everybody out of the pool. The homeowner had snacks prepared for us, so we had gone onto the covered patio to have a snack, and I thought, we're going to eat a snack and we're going to dry off and leave, say goodbye and thank you. So I took her life jacket off, dried her off, sat her down at the table with a snack, and the moms were talking and the children were talking, and it was raining and lightning and nobody was close to the pool, and all of a sudden I looked around and said, where's Elise? Ran to the pool, and there were some rafts and toys floating in the pool, and sure enough, she was at the bottom of the pool under a raft. So she had wandered down there. So at that time, I pulled her out of the water and I screamed dial 911 and I started CPR. And it took the EMT about 15 minutes to get there. We were out in the county. We had her breathing by the time the EMT arrived. My goodness, there were probably 8 firefighters that showed up to help. They took her via ambulance to the local hospital, and then she was transported to Cardinal, Glennon. And then we spent 2 weeks here. And she was on a ventilator in an induced coma for about a week. So her injuries were very serious. We weren't sure if she was going to make it. We didn't know if we were going to be facing severe neurological impairment. So we were just extremely thankful that we had a very, very, very successful, good outcome.
And so, doctors, what's your advice for those parents, like, CPR, right?
Yes.
What happens when you come out and if your child's in that situation?
So, I don't think we can overstress the importance of CPR, bystander CPR. In severe drowning events like this, the good outcomes pretty much only happen if bystander CPR takes place. That's just the facts. If there wasn't bystander CPR being done, the outcome would not be as good. That's just the way it is. So that's the key first step is bystander CPR. It's really, we can't stress that too much. There is, if you're interested or a community is interested in getting training in CPR, a couple things that you can do. We do some training here. Lori's helps out with that. She's in charge of that. If you call SSM Docs, 314 SSM Docs, they can get you some information there. We also have information on our website, cardinal.com. I would also encourage you to talk with your local fire department. Virtually all of them are involved in doing community CPR training. it's really the next key step in improving survival from not just drowning, but any type of, sudden death, cardiac arrest type of situations is really, really revolving around bystander CPR. So if there's one message, probably in addition to obviously prevention, is the importance of getting CPR training. And they will teach you what to do. So the question is what to do. The key is get your CPR training, recognize when it's necessary, perform it, call 911, and again, and stay on the phone. Exactly. Even if you don't know train, if you have not been CPR trained, call 911 and they can get you. They can do an awful lot just by walking you through it over the phone. But you'll feel 1,000 times better if you and everyone else around knows how to do CPR. It's truly life-saving skill.
I'm just going to emphasize exactly what Dr. Laffey said. Learning CPR is key, gaining the knowledge, but also gaining the competence. Any type of CPR is actually effective much better than nothing. So even if you walk through it for the first time on the phone, the results are better than not. But having the knowledge, having the competence, and then the confidence to be able to use it. As some of us learn things, but when we've never actually done it, we sort of freeze in the moment. And you need yourself or another person to take the lead to actually start doing the CPR. I've had people worry, well, what if they didn't need it? Well, if you don't need it, they'll be telling you that real quick, because you will see signs of life. Short of before the CPR prevention, listening again to Lisa's story, it could happen to any of us, and does happen to any of us in the families that we meet and see. But what got Elise to go back to the pool? Well, one thing that is talked about in prevention is not just lock that pool up, but remove all the toys and flotation things, anything shiny, colorful, that would draw a kid back. And that, it seems, might be why Elise went back. I don't know, it wasn't the food, I imagine. But her story, Mom maybe didn't emphasize it, maybe it brings back bad memories, but she was about as sick as they can come, and it was miraculous, her survival. She was, her lungs developed a severe inflammatory reaction, not just the water that got in there, but the whole event of suffocation and the irritation from the pool, which I'm sure was very clean water, created an inflammatory reaction that took days to weeks to get better. And actually, I remember now even just talking about it, her x-ray looked terrible, even at the time we took her off the breathing machine because of the inflammation inside the lungs. And we had a little debate going on whether we should get another x-ray to look or not. There was Elise playing, actually, even giving a small concert on her little recorder. So what do we need an x-ray for? But as a team, one was gotten before she left, and it did look normal the day before discharge.
And again, that whole process is the drowning process. That wasn't delayed drowning or secondary drowning. That whole process is the delayed process. There's a very common misconception about the amount of water, and I think Dr. Garrett mentioned that. The thought is that you're inhaling all this water and your lungs fill up with water, and that's generally not what happens. That's not the more common way. When the lungs fill with fluid, as they did in Elisa's case, it's actually not pool water. It's the body's reaction to the inflammation and the irritation. So again, the amount of water usually is not the key process. It's the time underwater, the lack of oxygen to the brain, and even fairly small amounts of water can trigger that inflammatory pathway that can kind of build on itself. So again, the idea that you're inhaling large amounts of water generally is frequently not the case.
Any other question for our panelists? Okay, well, thanks for coming.
Ask a couple real quick. One of them is on the dry drowning again, as you mentioned, it went viral. You mentioned this earlier, but can you put it into a 16-second soundbite to tell people, should they be, dry drowning, secondary drowning, should they be scared by that term?
I think that what we really want to do is not use those terms anymore. We want to say that, so drowning is defined by any type of respiratory issues that occur after you've been underwater. So you come out and you cough and you gag and you choke and you sputter and it takes a while for you to get better. That's a drowning event. It's a drowning event that had a really good outcome and really no problem with it. You could also have a drowning event that results in some illness and sickness and varying degrees, not always that severe, sorry. And then you can also have a drowning event that results in death. So that's really what we're trying to get into. There isn't any benefit, there isn't any medical meaning to the words dry drowning or wet drowning. It just doesn't, there isn't any meaning to it, nor is there any way that we determine which one it is, or does it make any difference in our management? How the amount of water in the lungs really isn't key at all. So we're trying to focus on when you need to seek care, which again, anything other than that kind of water going down the wrong pipe thing, it's definitely worth coming. We want people to come and have us evaluate them, but we also want to make sure we're comfortable that after, if as far as the way things work is over the next several hours, either you're going to get better or you're not. And if you don't, we keep watching. If you do, then things do good. But if you do get better over the next 6 hours, if you get sick 24 hours after that, 48 hours after that, it's really important to make sure we don't blame that on drowning, because that's generally not the case. We need to look for other causes of it, rather than saying, oh, this is because you had that drowning event, because that's not the way that drowning works. Drowning doesn't have a lucid interval, a time when everything's completely fine for 2 days, and then you start having symptoms. We just know that that's not the case. There really has never been a documented case of a patient who was seen in the emergency room, observed, they're deemed to be fine, and went on to have problems. It just really, practically speaking, doesn't really happen. So again, being really clear on the definitions is helpful, just so and I think that alone we don't want to decrease anxiety necessarily. We want to make sure the awareness is there, but we also want to make sure it's focused appropriately. That's, I think, is really what we're trying to do.